You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Millie Armstrong, owner of Petit Brook Veterinary Clinic in Vermont. Welcome, Millie.
Hi, thanks for having me.
Yes, I'm so excited to have you on the show. Today I wanted to ask you a question. What happens when a dog's stomach bloats? You hear a lot about dogs and family friends that dogs have passed away because they've gotten into the Boy Scout cookies that were left on the stairs, or the Girl Scout cookies. And actually my girls were asking about it, and I know that the stomach twists because we've had a dog had to have her stomach pumped because she ate a whole bag of birdseed.
Oh my.
But I didn't know what actually happened. So welcome, and thank you for being on the podcast.
Well, I appreciate you having me. I think that's a really good question because it's something that a lot of people hear about but don't necessarily understand the technical aspects of what happens. And really it's sort of a two-step process where the dogs, just like your dog who got into birdseed, will overeat, and they'll eat too much food, or they'll get into compost, or a whole bag of dog food, or horse grain. Or even if they drink too much water, the stomach will swell and it will expand, and it will get to a point where it's so swollen that it naturally then does the second step where it twists on itself. And it'd be like when you have the animal balloons that the clowns are twisting and turning into different legs and heads and things. It's that twisting motion that the stomach makes on the esophagus that kinks off the stomach and then prevents the dogs from being able to vomit. Normally they would be able to vomit, empty their stomach, get rid of the contents, and their stomach would go back down to a normal size. But if the stomach twists and kinks that outflow up through the esophagus area off, then the fluid and gas and food can't empty, and the stomach really begins to lose blood supply. And as the blood supply diminishes to the stomach, then the stomach wall begins to get really bruised and purpley, and the tissue begins to die off. And that releases a lot of toxins, which makes the dog even much more critically ill and more sick. So when the blood supply gets kinked off, it's also getting kinked off back to the heart. So when the heart can't receive the blood it needs to pump out to the critical organs like the liver, the kidneys, the heart itself, the brain, then the dogs go into crisis and they become very shocky very quickly. Sometimes when the stomach twists, it also drags the spleen along with it. The spleen is the organ that holds a lot of extra blood within it. And when that rolls over, it also kinks off and further restricts the blood supply back to the heart. So it doesn't take long for dogs who bloat and tors. The twisting is called a torsion. So once the dog's tors, it can be literally a matter of minutes before they can become very ill very quickly, and it can be a very life-threatening situation. So what I tell people to watch for who have breeds that are predisposed to this, and that tends to be the large breed dogs like the German Shepherds, the Golden Retrievers, Boxers, Dobermans, Great Danes, the Afghans, breeds that have very deep chests that extend down closer to the ground instead of their barrel-shaped chests like the Bulldogs and the Cocker Spaniels that tend to be more rounded. It's the deep-chested, large breed dogs that are prone. So we want to make sure that they don't inadvertently get their dogs in a situation where they're going to potentially swell or bloat and then possibly go on to the torsion. So Try to minimize the amount of food they eat at one time. We do know that it's related to overeating, so don't let them sit down and tank up on a big bowl of water after they've been out running and playing for 2 hours. Let them have time for them to settle down and wait an hour before they come in and drink. Don't let them have access to the grain barrel. Keep those closed, that kind of thing. I guess that's kind of common sense, but that you can't always control that because the dogs counter surf. They get the loaf of bread off the counter. They eat the box of Cheerios that were on the low-lying shelf. So it's hard to control all of that. I understand. So we try to prevent the potential risks, but if you do suspect that your dog may be bloating, you'd notice symptoms. The first thing you'd notice is that they'd be trying to vomit, but they can't bring anything up. They're gagging and retching, but the only thing that comes out is a little bit of saliva because, remember, the esophagus is kinked off, and so things can't come up from the stomach. So they're trying to vomit, and they can't bring anything up. Because the blood supply has been kinked off, they don't have good circulation to the peripheral tissues. And so look at the gum color. Lift up the lip, look at the gums above the teeth and see if they look nice and pink. Press on them, see if they blanch white but then return pink quickly, or if they stay pale or white for an extended period of time. That's never a good sign. So you definitely want to call the veterinarian quickly. Do not wait until the morning. If there's somebody on call in the area or an emergency clinic, get them seen. It may not be a situation where they're bloating, but if you wait, then you run a risk of possibly losing the patient because it can go on pretty quickly. And then there's a way to do surgery to try to decompress the stomach and derotate the stomach, but that's something they want to get into pretty fast. You don't want to wait on that. It's pretty critical.
So it's a surgery to rectify the situation?
Yes.
Okay.
There is a surgery that can be done to try to prevent the swelling and the bloating and the torsion, but the surgery isn't always a guarantee that they're still not going to have trouble down the road. So a lot of times when we're spaying the dogs or neutering the dogs, the young dogs, the breeds at risk, we'll often do what's called a gastropexy, where we actually tack the stomach to the side of the abdomen to try to help form scar tissue to keep the stomach from being able to turn. But I have seen dogs who've had the gastropexy done still tours and become quite sick. So I hate to set that up as a guarantee preventative because it doesn't always work, and they could still bloat and have other issues from the distension from the stomach.
Okay. So good to know. And how much time do you have? Like, I've actually watched a lab's stomach just start to expand and the vet, and I got the dog to the vet, but I'm sure in the situation where my friend's dog passed, the dog was at home alone, ate the candy, and then they came home from work and the dog was pretty ill. That's
really heartbreaking when that happens. I've seen that too, where people come in and they've just picked up their dog from the kennel and the dog was fine when they were walked and checked on at 8 o'clock at night, but then by 6 o'clock in the morning, they're in rough shape. So it can happen very quickly.
Okay.
It doesn't take long.
Okay. Well, thank you very much for being on the podcast and giving us tips on what happens when a dog's stomach bloats. And hopefully it will warn all of the dog owners out there to be careful and to definitely get to the vet immediately.
Exactly. Right. And try to prevent the situations where they might inadvertently trigger a bloat situation, like the high exercise and overeating, overdrinking, that kind of thing. So thank you for having me.
Yeah, I look forward to having you back on the podcast. Thank you very much.
Thank you. Bye-bye.
Bye.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.